Okay, welcome everybody. This is our discussion of the endocrine system. And one of the things that we need to point out is that this is one of the body's two communication networks, the other one being the nervous system. And the reason the endocrine system evolved is to solve a problem that the nervous system couldn't, which is how to allow the different body systems to communicate with each other in a way that doesn't involve the use of so much energy and also doesn't take up a lot of physical space. So the way the endocrine system does it is through chemicals called hormones that are secreted into the bloodstream by endocrine glands, and they are going to travel in the bloodstream until they arrive at tissues that have molecules on their surface that will bind to those hormones. And when that happens, that makes those tissues carry out the instructions that hormone is designed to start, okay, to begin. So we'll talk about what the endocrine system does. We'll talk about the anatomy of the endocrine system, which is pretty simple, and then we'll talk about what the different glands secrete and what the effects of those hormones are. Endocrine glands are throughout the body, okay? They regulate metabolism. They control growth. They control fluid and water balance, blood sugar levels, blood calcium levels, reproductive cycles, okay? Lots of different things, okay? The nervous system, which we've already talked about a little bit, communicates by electrical signals called nerve impulses that are very rapid and have a short-term impact. The endocrine system uses hormones, and the impact is usually longer term. It also takes a lot less energy to carry out. So if we look at the anatomy of the endocrine system, you can see here that the glands that are part of the endocrine system are throughout the body, starting up near the brain and ending down near the gonads. We could start up top and talk about what each of these does. The pineal gland is on the back of the brainstem, and it produces a hormone called melatonin, and that's designed to control when we're asleep and when we're awake. So this is part of what makes us more tired when it's dark out and makes us more active when the light is on, okay? The hypothalamus is sort of the commander-in-chief of the endocrine system because it controls the pituitary gland. The pituitary gland has two lobes, an anterior and a posterior, and the job of the pituitary gland is to cause other glands to secrete their hormones and make those effects, okay? And then there's also some pituitary hormones that control smooth muscle contraction and also water balance, okay? As we move down, this is the thyroid gland, and it produces two hormones, calcitonin and thyroid hormone, or thyroxine. Thyroxine is going to accelerate our metabolic rate, and calcitonin is going to increase our bone density and lower our blood calcium levels. The glands on the back of the thyroid at the edges are called the parathyroid glands, and it produces parathyroid hormone, which raises blood calcium levels. And the thymus is where T lymphocytes mature into cells that are better at fighting disease. And the hormones produced here are called thymosins and thymopoietins. The adrenal glands are really two glands in one. The adrenal medulla produces adrenaline, which is a hormone that's important in what we call the fight or flight response. And the adrenal cortex produces hormones that control sodium and potassium balance, blood sugar levels, and also sex hormones. Okay? And then the pancreas is going to produce insulin and glucagon, and those control blood sugar levels. Okay? And the gonads produce hormones that regulate secondary sex characteristics and reproductive cycle. Okay? And those are things like testosterone, estrogen, and progesterone. Okay. Um, Hormones are chemicals that are secreted into the blood by endocrine organs. And they can either be water soluble or they can be lipid soluble. Okay? Um, Water soluble hormones tend to be proteins or amino acid derivatives, which means they're amino acids that have been chemically changed in a way to turn them into a hormone signaling molecule. Okay? Or they are lipid soluble, um, and those tend to be um, chemicals that are based on cholesterol, or in one unusual case, um, thyroid hormone and T3, which are both um, amino acid derivatives that contain iodine. Okay, um, the difference between the two, right, is that when it's a water soluble hormone, the receptors on the target tissue are going to be on the surface of the membrane, whereas in a lipid soluble hormone, the receptors are either going to be inside the target cell in the cytoplasm, or they're going to be even in the nucleus. And that's because lipid soluble hormones can go right through the membrane with no special assistance. Okay? With the exception of secretions from the adrenal cortex and the gonads, most hormones are protein or protein related. Okay? The adrenal cortex and the gonads secrete steroid hormones, okay, which are mostly made of carbon and hydrogen and are therefore lipid soluble. Okay? So glands are going to affect their target organs based on whether or not they contain a receptor for that particular hormone. And we talked about the fact that if it's a water soluble hormone, the receptor is going to be on the membrane surface, and if it's a lipid soluble hormone, it's going to be inside the cell, either in the cytoplasm or in the nucleus. Okay. Organs that don't have receptors for those hormones aren't going to respond to them. Okay, so those hormones will just pass those glands and tissues by, and they won't have any effect. One of the ways that we control hormone secretion is through either negative or positive feedback. Most of the time, negative feedback is the mechanism. Um, there are hormones that either rise or fall as a result of um, changes that occur within the body or outside the body. An example would be melatonin, whose levels are um, high when the light levels are low and low when the light levels are high. Okay, um, the central nervous system is going to um, control some of the glands in the endocrine system, either because they share structures or because they're directly influenced by structures. The two places where the nervous system and the endocrine system intersect in the body directly is in the adrenal medulla and in the hypothalamus and the posterior pituitary gland. Okay, so what happens in the nervous system can definitely affect the way that the endocrine system functions. So let's take a look at positive and negative feedback.
During the menstrual cycle, before ovulation, small amounts of estrogen are secreted from the ovary. Estrogen stimulates the release of gonadotropin-releasing hormone from the hypothalamus and luteinizing hormone from the anterior pituitary. Gonadotropin-releasing hormone also stimulates release of luteinizing hormone from the anterior pituitary. Luteinizing hormone, in turn, causes release of additional estrogen from the ovary. The levels of gonadotropin-releasing hormone and luteinizing hormone increase in the blood due to this positive feedback effect. After ovulation, the corpus luteum is formed in the ovary and begins to secrete progesterone in response to luteinizing hormone. Progesterone inhibits the release of gonadotropin-releasing hormone from the hypothalamus and luteinizing hormone from the anterior pituitary. Blood levels of gonadotropin-releasing hormone and luteinizing hormone decrease because of this negative feedback effect.
Okay, so we'll start at the top. The hypothalamus is the control center for much of the rest of the endocrine system because it controls either directly or indirectly the action of the pituitary gland. The hypothalamus produces inhibiting or releasing factors that enter the bloodstream in a capillary network called the hypophyseal hypothalamic portal system, okay? And it'll flow from that capillary bed in the hypothalamus directly to a capillary bed in the anterior pituitary, and that affects the release of the hormones from the anterior pituitary, okay? In the case of the posterior pituitary gland, the hormones, antidiuretic hormone and oxytocin, are actually manufactured in the hypothalamus, and then they are stored in the posterior pituitary, and they don't get secreted until they get nerve impulses from the hypothalamus indicating that they need to be released. The hormones of the anterior pituitary affect a wide range of different systems, okay? They include adrenocorticotropic hormone, luteinizing hormone, follicle-stimulating hormone, human growth hormone, melanocyte-stimulating hormone, prolactin, and thyroid-stimulating hormone. Okay? So, what most of these do is target other glands and tell them to produce their secretions. As an example, okay, thyroid-stimulating hormone is designed to cause the thyroid gland to release thyroid hormone, T3 and T4. Okay, adrenocorticotropic hormone causes the adrenal cortex to release cortisone and cortisol, and to a lesser extent aldosterone. Okay, and follicle-stimulating and luteinizing hormone target the gonads and cause them to release estrogen, progesterone, testosterone, depending on which gonadotropin we're talking about. Okay, so that's one of the reasons that we say that the pituitary gland is the master gland, because it has control over a lot of these other endocrine organs. Okay, so those two parts of the pituitary are very different from each other, right? The anterior pituitary is epithelial tissue, glandular tissue, which is designed for secretion and has an extensive blood supply, okay, from that portal system we talked about, and is controlled by those releasing and inhibiting hormones from the hypothalamus. And then the posterior pituitary is actually neurosecretory tissue, and it's literally an outgrowth of the brain, okay? The little stalk that connects the anterior and posterior pituitary to the brain is called the infundibulum, okay? And it is essentially nervous tissue. Okay? The hormones of the anterior pituitary, thyroid-stimulating hormone, causes the thyroid gland to produce T3 and T4. Adrenocorticotropic hormone causes the adrenal cortex to release cortisone, cortisol, and to a lesser extent aldosterone. Growth hormone promotes the growth of epithelial and connective tissue throughout the body. And gonadotropins control the release of hormones from the gonads, which, along with the gonadotropins, also has an effect not only on secondary sex characteristics, but also reproductive cycles. Okay? And then prolactin promotes milk production from the breasts. In the posterior pituitary, antidiuretic hormone targets the kidney tubules and causes them to retain more water. And so that causes your blood volume and your blood pressure to rise and causes your urine volume and urination frequency to go down. Okay? And then oxytocin promotes smooth muscle contraction. So that helps with giving birth, and that also helps with milk ejection from the breasts. And it's also important in emotional bonding between mother and child. Okay? So it's one of those warm and fuzzy hormones. There is a tiny fetal structure, which is a gland that has melanocyte stimulating hormone as one of its products. It's often classed with the anterior pituitary, and that causes production of extra pigment. Okay, we don't really know in humans what its importance is. Okay, in other animals, it has an effect on sexual maturation. Adult cells generate something called propionmelanocortin. Okay, and essentially, eventually, what happens to the third lobe is that the cells are incorporated into the anterior pituitary, and the adult pituitary doesn't have this third lobe. So this third lobe just becomes the anterior pituitary. Okay. Propionmelanocortin is degraded in the pituitary to adrenocorticotropic hormone and endorphins. Okay. ACTH, we already know what that does, but endorphins are sort of like the body's painkiller, right? So when they're produced, the pain signal that comes from nociceptors and up the spinal cord is slowed down, or in some cases knocked out. Okay? We're going to talk about some of the other endocrine organs and what they do, okay, and talk about what happens when they go into overdrive or when they're inhibited. Okay, the thyroid gland is right below your larynx and is unusual in that it contains follicles, which are basically polymers of thyroxine precursor. Okay, and this is a lipid-soluble hormone, so this is unusual in that it's an amino acid derivative, but it contains iodine atoms that are attached to it that make it fat soluble instead of water soluble. So it has to be transported in the blood by transport globulin proteins. Okay. What do T3 and T4 do? Well, they accelerate your metabolic rate and raise your body temperature. Okay, so they increase the rate at which we burn fat. Okay. The parafollicular cells generate a hormone called calcitonin, which causes bone density to rise and blood calcium levels to fall. Now, calcitonin is not lipid soluble; it is a water soluble hormone. Okay, so that's what T3 and T4 do. Okay, before you're born, T3 and T4 are critical for the normal maturation of the nervous system and growth and development. If you lack T3 and T4 while you're in utero, you develop a condition called cretinism, where you have short stature, cognitive deficit, usually shortened lifespan. Okay? Calcitonin, as we already discussed, is designed to bring blood calcium levels down and increase bone density, so it's an antagonist to parathyroid hormone. Okay? When the thyroid gland is ineffective, okay, one of the things that you show is a hypothyroid or we sometimes call this myxedema. Okay, so what you tend to see in these individuals is the accumulation of body fat, the reduction in body temperature. You tend to be slow moving, low energy. Okay, the metabolic rate goes way down. Okay, and the fix is to give thyroid hormone. In both hypothyroidism and hyperthyroidism, we see an enlargement of the thyroid gland called goiter. Okay, in hypothyroidism, the reason for the goiter is that the production of thyroid stimulating hormone um, from the anterior pituitary does not result in the production of T3 and T4, and so thyroid stimulating hormone levels continue to be high, and the gland hypertrophies. Okay, it gets larger because it can't meet the demand of the commanding hormone. Okay, in hyperthyroidism, we have overproduction of T3 and T4. That can be the result of a tumor on the gland. It can be the result of a condition called Graves' disease, in which um, autoantibodies attach to the thyroid gland and lock it in the on position. These individuals tend to be thin, have high body temperature, have bulging eyes, and they tend to be anxious, okay, all the time. And the fix is to deal with whatever's causing the condition. If it's a tumor, we have to excise the hypersecreting tumor. If it's autoantibody, then we have to give immune suppressants in order to turn the gland back down. And we can also give thyroid hormone antagonists. Okay? The way that this is controlled is through the hypothalamic hypophyseal um, axis. Okay, so the way it all starts is that as T3 and T4 levels fall, thyrotropin releasing hormone from the hypothalamus gets into the bloodstream and gets to the anterior pituitary, and that causes release of thyroid stimulating hormone, which then hits the thyroid gland and causes production of thyroid hormone. As blood thyroid hormone levels rise, they eventually feed back and inhibit production of TSH from the anterior pituitary and TRH from the hypothalamus. Okay, and that's an example of what we call negative feedback. Okay, this is why sometimes when the thyroid gland is misbehaving, it may not necessarily be the fault of the thyroid gland. It may be the fault of either the hypothalamus or the anterior pituitary. There could be a tumor on the anterior pituitary over secreting hormone, or there could be a problem in the hypothalamus causing it to release too much or too little TRH. Okay, any problem in the upstream command structure is going to have an effect on the downstream organ. So this is why you typically run blood tests for all of these hormones to determine who the bad actor is. Okay? Iodine is critical as a building block for thyroid hormone, and we get it in our diet primarily through iodized salt. If we lack iodine in our diet, we're going to have an underactive thyroid because we lack the building blocks to make the hormone. Okay? It also is prevalent in seafood, a lot of iodine in seafood. Okay? And you can also take supplements. A lot of third world countries have increased incidence of hypothyroid because they lack a natural source of iodine in their diet. Okay? The parathyroid glands produce a hormone called parathyroid hormone, and this is designed to increase blood calcium levels. It also reduces bone density. Okay, so it's an antagonist to calcitonin. You have to remember that parathyroid hormone is critical. It can recover calcium from blood, from kidney, and from intestine. And calcium is critical in processes such as blood clotting, in nerve transmission and muscle contraction, and in cell signaling. Okay, so if our calcium levels get messed up, all of those processes are going to suffer. Okay, an imbalance in blood calcium is going to cause problems throughout the body. Right, the thyroid gland secretes calcitonin if the blood calcium levels get too high, and it causes the blood calcium levels to drop by stimulating osteoblast activity and allowing the kidney to excrete calcium. Okay, so if we have too much parathyroid hormone in our system, all right, then our blood calcium levels get too high. We have hypercalcemia, and that's going to result in tetany and spasm. Um, the, uh, the the way to remember this is stones, bones, groans, and psychiatric overtones. Right, bones for bone pain, and that's related to the loss of bone density. Stones for kidney stones. Moans for problem with smooth muscle contraction, and groans as a result of, um, again, problems with muscle and nerve activity, and psychiatric overtones because of your state as a result of these high calcium levels, right? Um, Kidney stones, as an example, are extremely painful, okay? So that's just one reason that we have problems, right? Um, Calcium stabilizes nerve and muscle membranes. As a result of deficiency, causes sustained or tetanic contraction of muscle with spasm. Tetany affects the larynx and the breathing apparatus. Patients with this condition may not be able to breathe because you'll freeze up the diaphragm. Okay. The adrenal glands are above each kidney, and they're really two glands in one. Okay, there's an adrenal cortex, and that surrounds an adrenal medulla. The medulla is neurosecretory tissue and produces adrenaline in response to nerve impulses from the sympathetic division of the autonomic nervous system when we perceive a threat or panic. Okay, um, that goes directly into the blood, and that keeps you sort of amped up for quite a while, right? That's going to elevate your heart rate and your blood pressure and your breathing rate. It's going to cause excess production of sweat. Um, it's going to promote the production of glucose in the blood, right? And all of this is designed to get more oxygen and more fuel to the muscle tissue in order to you to be able to sustain your activity longer. Okay, so um, another effect is to route blood away from the urinary and the reproductive and the digestive system and to the heart and lungs and to the skeletal muscle. The adrenal cortex is the surrounding glandular tissue, and it's divided into three different zones. Okay, the glomerulosa, the fasciculata, and the reticularis. And the way to remember the hormones produced by the cortex is the mnemonic salt, sugar, sex. Okay, the glomerulosa produces aldosterone, which promotes potassium secretion and sodium retention, and also increases blood volume and blood pressure. The fasciculata produces cortisone and cortisol, which raise blood glucose levels and suppress inflammation. And the reticularis produces basically testosterone. Okay, they're called androgens, and they're a lot like testosterone, and they raise your hematocrit and your bone density and your muscle mass and your libido. Okay, and this is one of the reasons why these hormones are prized as performance-enhancing drugs by athletes. Okay, so there's the adrenal medulla and what it produces, right? And there are the corticoids that are made by the adrenal cortex, right? The glucocorticoids are important because they raise your blood glucose levels between meals. They're going to have an impact on fat metabolism, burning substances as fuel, and that increases energy production. One of the things that happens as a result of this is that we do what's called glucose sparing, so that we save the glucose primarily for the central nervous system, and then other tissues that can use other fuel switch off and use that fuel. Okay. The mineralocorticoids, aldosterone, we've discussed, right? The kidney is the target here, right? And then the sex hormones, estrogens and progesterone, and in the male we have the androgens like testosterone. Okay. The estrogen and progesterone is important in the female because it regulates the menstrual cycle, well, we say the uterine cycle, and the ovarian cycle. All right, very important. And that affects the timing and release of the egg in order to maximize the likelihood of fertilization and development, right, in the female reproductive tract. The reason that production of aldosterone raises your blood volume is because as you retain more sodium, you retain more water, and that results in an increase in blood volume and blood pressure. Addison's disease is a result of low production of cortisol, okay? Adrenal cortical insufficiency. With Addison's disease, what are you going to see? Well, you have a deficiency in the production of cortisol. Your blood sugar levels are going to drop, okay? So you're going to be hypoglycemic, okay? Usually it's also accompanied by a bronzing of the skin. There are also effects with aldosterone, okay, that involve underproduction, okay? Deficiency causes diuresis, low blood volume, low blood pressure, and shock, right? Hypersecretion, Cushing syndrome, results in the deposition of fat in the face and in the trunk, okay, and in elevated blood glucose levels, right? Sometimes Cushing syndrome can be brought on as a result of steroid treatment, in which case we call it iatrogenic Cushing syndrome. Steroids are typically used to reduce inflammation, and sometimes if they're given over a long course for a patient, the effect can be dramatic, okay? It goes away once the steroid use is discontinued. The pancreas is wedged between the duodenum and the spleen behind the stomach, and it, as an endocrine organ, produces insulin and glucagon, okay? The production of insulin is important because it allows the cells in the body to use the glucose in the blood for fuel. So it's a signal saying that basically the sugar is here. You better pick it up and use it to make energy. It also tells the liver to store a lot of that sugar as fat or as glycogen. All right. In the production of glucagon, we have the opposite effect. It targets the liver and it promotes gluconeogenesis, okay, which is the production of sugar from fat and glycogen stores, and that raises the blood sugar levels between meals, right? In normal metabolism, increased transport of glucose into cells which are insulin dependent includes everything except the nervous system, okay? And then we store the glucose as glycogen or fat by the liver. It also stimulates protein synthesis in cells, and it stimulates fatty acid synthesis as well, okay? One of the defects in insulin production is a condition known as diabetes, all right? So let's take a look at diabetes.
Diabetes mellitus is a complex disorder of metabolism. It is a disease in which the body does not produce or properly use insulin. Insulin is a hormone that is needed to convert sugar, starches, and other food into energy needed for daily life. There are three major types of diabetes. Type 1 diabetes, also known as insulin-dependent diabetes mellitus, IDDM, or juvenile onset diabetes, results from the body's failure to produce insulin. An individual with type 1 diabetes needs to take daily insulin injections for the rest of their lives. It is estimated that 850,000 to 1.5 million Americans have type 1 diabetes. Non-insulin dependent diabetes mellitus, or adult-onset diabetes, results from insulin resistance combined with relative insulin deficiency. Approximately 16 million Americans have type 2 diabetes. Someone with type 2 diabetes may make healthy or even high levels of insulin, but obesity makes the body resistant to its effect. Even modest lifestyle changes, such as eating a healthy diet, exercising 30 minutes a day, and maintaining proper body weight for age and body type, can help prevent type 2 diabetes. Prediabetes occurs when a person's blood glucose levels are higher than normal, but not high enough for a diagnosis of type 2 diabetes. Without lifestyle changes, most people who have prediabetes will progress to type 2 diabetes within 10 years. Gestational diabetes, or pregnancy-induced diabetes, develops in a pregnant woman. In most cases, this type of diabetes goes away after the child is born. It affects about 4% of all pregnant women, or about 135,000 cases in the United States each year. The American Diabetes Association estimates that about 17 million people in the United States have diabetes, and 5.9 million Americans have diabetes and do not know it.
So, when we're talking about either an insensitivity or lack of insulin production, the consequences are going to be elevated blood sugar levels, especially following a meal. And that's because the cells aren't going to get the signal to take the insulin up or to take the glucose up and use it for fuel, so it stays in the blood. The result of the high blood sugar levels is hyperglycemia, which is basically a term for high blood sugar. Glucosuria is sugar in the urine, and that's due to the fact that there's so much sugar in the blood that the kidneys are unable to put the sugar in the blood filtrate that the kidneys make back into the blood. And so it stays in the urine, and that's going to draw more water into the urine, and that's going to result in high urine volume and high urination frequency, and that's polyuria and polydipsia. The lack of the ability to use glucose for fuel results in excessive thirst and hunger. Polydipsia is excessive thirst, polyphagia, excessive hunger. Acidosis is due to the fact that since the body can't use sugar for fuel, it uses fatty acids. And when you only rely on fatty acids to make fuel, you generate byproducts called ketone bodies, and you go into a condition known as ketoacidosis. And these are compounds that are lost in the breath and in the urine and in the sweat, and it produces an odor that smells a little bit like a nail polish remover, right? Because this is a compound that's similar to acetone. The problem, of course, is that if this continues, it'll eventually upset the pH of the body, and that can result in conditions as serious as coma and death. Glucagon is a hormone that is going to do the reverse of insulin. Essentially, glucagon is going to raise blood sugar levels by targeting the liver to go into glycogenolysis and gluconeogenesis. And so what those are, the breakdown of glycogen to release glucose into the blood, that's glycogenolysis, and gluconeogenesis is the production of new glucose from compounds like glycerol, okay, that are part of stored fat. And the result then is the blood sugar levels are going to go up. The gonads produce the sex hormones. Testosterone, estrogen, and progesterone are produced by both men and women, but men make more testosterone than estrogen and progesterone, and women make more estrogen and progesterone than testosterone. The purpose of testosterone is to control male secondary sex characteristics such as axial and body hair and libido and muscle mass and bone density go up, and hematocrit goes up, um, metabolic rate goes up, and it also has an effect on sperm production. Okay, estrogen and progesterone is designed in women to um, coordinate the ovarian and the uterine cycle so that ovulation, uh, which is the release of the egg from the ovary, is a greater probability of leading to fertilization and pregnancy. Right? The thymus secretes thymosins and thymopoietins, and those aid in the maturation of T lymphocytes so that they're capable of helping the immune system fight disease. And the pineal gland we talked about produces melatonin, right? And that's going to control our circadian rhythm, which essentially is our activity levels when light levels change, right? So when light levels go down, our activity levels drop. When light levels go up, our activity levels go up. Okay, and the melatonin has an important role in that. The heart um, produces atrial natriuretic peptide, which causes blood volume and blood pressure to go down because it increases sodium secretion by the kidneys, and so that pulls water out of the body and into the urine. Digestive organs produce hormones that coordinate their actions, such as cholecystokinin, secretin, gastrin, okay, and enterogastrones. And then prostaglandins are local um, chemical signals, that we call them paracrines, and they're important in smooth muscle contraction, inflammation, and pain. Okay? Important point with prostaglandins is that aspirin and ibuprofen block their synthesis, and that enhances the ability to suppress inflammation. Okay, and the result is that this decreases the sensitivity of nerve endings to pain. Other important hormones include renin and erythropoietin from the kidneys. Um, Renin is designed to convert angiotensinogen to angiotensin 1, and then in the lungs, angiotensin converting enzyme, or ACE, converts angiotensin 1 to angiotensin 2, and that leads to a whole cascade of effects that results in increasing blood volume and blood pressure. Okay, this is why ACE inhibitors are used to control hypertension. And then we've also got erythropoietin, which is produced in response to falling blood oxygen levels, and the result is that the hematocrit goes up. Okay? Adipose tissue hormones are important. Adipose tissue produces leptin, which is an appetite suppressant. Okay? Note that adipose tissue has a lot of blood vessels. Additional blood vessels increase blood pressure. In additional blocked blood vessels increase blood pressure and strain the heart. This is one of the reasons why if you eat a lot and have a high calorie content, this raises your blood cholesterol and your blood triglycerides, and that can accumulate as plaque on the walls of arteries, and that makes you a greater risk for heart attack and stroke. Okay? Adipose tissue also makes cytokines that are going to affect glucose metabolism and are going to promote this type 2 diabetes, which is basically insensitivity to your own insulin. Okay? And the result then is that even though the insulin gets produced, the target tissues don't respond to it, and the blood sugar levels then go up. Okay? All right, I thank everybody for joining me for this podcast, and I will see you in the next podcast. Again, if you have any questions, make make sure and shoot me an email, and I should get back to you within 24 hours. I thank you for listening.